Another question for you all.
Yes. So some groups of people have higher rates of COVID or higher risk of death. What do you already know about this?
Um, People with weakened immune systems, people with pre-existing conditions. It seems like adults around ages 20 to 30 got the most affected
Mhm.
based on the news.
Yeah. Okay. Yeah. So just to address that last one, recently we've been seeing more younger adults affected, but that's since the vaccinations have started. But we definitely know that older adults are at higher risk. Okay. Yeah. So I I wanted to. I mean, we did want to talk to you guys a little bit about health disparities and health equity when it comes to COVID. And so the reality is that COVID-19 has really highlighted some of those disparities and kind of shown that there are certain groups of people that are more affected, not just thinking of people with those medical conditions like people that have obesity and those type of things, but also groups of people like Latinos, African Americans, people in poverty, and those type of things. And um, so a health disparity in general, just to define the term, a health disparity is a concept that acknowledges that certain communities or groups of people have worse health compared to others. And looking at this map, this is what health disparities and lack of health equity looks like on a map. So communities and neighborhoods in Oakland have different experiences of COVID-19, and this map shows cases of COVID by zip code. So the darker the blue, the more cases of COVID. It's no surprise that the darkest blue areas are the same zip codes where more Black and Latinx families live and where there are more people living under the poverty level. While cases are falling compared to where they were in January here in Alameda County, among everybody pretty much, Latinx people are still about 4 times more likely to be diagnosed with COVID than white people, and African Americans are nearly 2 times more likely to die from COVID compared to their white neighbors. And poverty, we know, has a strong role too. So just one example, again, sticking at this map, continuing to look at this map, is from data that we looked at in November 2020. The 94621 zip code, which is in the southern part of Oakland, has about 30% of its residents living below this poverty level, while the Rockridge zip code 94618 only has about 5% of people living under the poverty level. And as you might expect, those living in that zip code in the southern Oakland part have about 10 times more cases of COVID-19 compared to the one in Rockridge. And so we'd like for everybody to be aware of these issues. And as we think about addressing these disparities, we have an opportunity in our fields to demonstrate our trustworthiness and to communicate as a system that we care about and we value the health of every single person, no matter what they look like or where they're from. And so this slide just summarizes some of those health disparities that we discussed about COVID-19. And so as you guys can see there, um, similar to what I just mentioned for the different groups. And I didn't want to read through these. I wanted you guys to look at them. And if there's any questions about these things, I'm happy to answer them as well.
May had a question.
Mhm.
She's wondering if what if some but not all of a student's family members have gotten the vaccine?
Yeah. Um, I'm not exactly sure what the question is referring to. So it is good if almost everybody has gotten the vaccine, that definitely helps protect that person who hasn't gotten the vaccine. So an example could be a family where there's a young child that doesn't qualify for the vaccine yet. If everybody in that household is able to get vaccinated, that's like an extra layer of protection for that child that isn't able to get the vaccine. So overall, it's good for that person and it helps them. And then as soon as things expand in terms of who's eligible for the vaccine, then we can get hopefully everybody in the family vaccinated. Does that answer the question?
And if the question is about where or how family members who are eligible can get the vaccine, we'll be sharing some resources a little bit later in the presentation.